The following program, The Lightning Strike, is sponsored by Mohammed Faheem and to the extent applicable their guests. The views and opinions expressed therein do not necessarily reflect those of NewsWeb Radio Company or its management.
Get ready to be jolted out of the ordinary and into a world where conversations are charged with intensity and facts. The Lightning Strike Talk Radio with your host, Mohammed Faheem, broadcasting live from the heart of the city on Chicago's Progressive Talk Radio, WCPT 820 AM. Welcome to a radio show that charges through the airwaves with an electricity like no other. Here's your host, Mohammed Faheem.
Good morning, Chicago, and welcome to the Lightning Strike. I'm your host, Mohammed Faheem. With me in the studio again today is Ken DeLuc.
Howdy, folks.
And Alderman John Arena.
Good morning.
And we got a power-packed show for you again today. It's going to be 1 full hour of power. And we also have with us in the studios today Manur Ahmad, who is running for the Illinois 6th Congressional District in the upcoming Democratic primary. So stay tuned. Manur would be with us at about 9:30. We have also Dr. Zaher Sahloul, who is the co-founder of MedGlobal, calling in to report about his recent medical mission to Gaza. And we have Abby Maxman, who would be joining us. She is the CEO and president of Oxfam. And also we have Bushra Khalidi, who will try to join us from Palestine. If we can get her online from there, we'll have Bushra also repeating what is actually happening on the ground over there without the filters of the media that is being controlled by the Israeli government. Okay, so that's the show for today, and our person of the week is again a great find. His name is Luther Johnson. Luther is the founder of the History on Wheels Museum in Joliet. Stay tuned, folks. We will dive right into the morning with Abby Maxman, CEO and president of Oxfam, joining us, and Dr. Zaher Sahloul joining us. He is the co-founder of MedGlobal. Good morning, Abby.
Good morning, and I do have Bushra on the line too.
Awesome. Thank you so much. Because we're trying to figure out how to get Bushra on all the way from Palestine. And Dr. Sahloul, good morning. Thank you for joining us.
Hi, thank you for having me.
Hey, Abby and Bushra, thank you both. It's a pleasure to get to talk to you guys. So we wanted to start off with Dr. Sahloul, and you recently came back from a medical mission to Gaza, and you are the co-founder of MedGlobal. Can you tell us a little bit about what MedGlobal is, what you guys do, and how long have you been doing it?
Yes. So MedGlobal was established in 2017. At that time, there were 3 humanitarian crises that happening at the same time. The war in Yemen, its impact on the population, the war in Syria, and the Rohingya refugee crisis. So we started by sending medical teams to improve access to health care and building clinics in partnership with the local communities. And with time, we evolved to do many things in different regions. Over the past 7 years, we worked in 25 countries to improve access to health care, especially in disaster-hit areas, in Ukraine, in Colombia, in Mexico, south of the border, but also in the Middle East, in Palestine, in Gaza especially, and Lebanon, Syria, Yemen, Sudan, and Bangladesh. And we provide training, we provide emergency response, we have sustainable healthcare programs, and also we try to improve the healthcare system by focusing on the donation of medical technology, equipment, and training. And in Gaza, we've been there since 2019. We are registered. We have a local team that implements most of our programs. Of course, since the beginning of the war, they've been really busy doing all kinds of stuff, initially in the north and now in the south.
Okay, thank you so much for that brief background, Dr. Sahloul. We'll come back to you in just a minute with what you have been facing over there, the challenges, and you guys are phenomenal. Abby, a little bit about Oxfam. What are you guys and who are you? I know that Oxfam is like in 80 countries. What do you guys do?
That's right. Thank you. Yes, Oxfam is a global organization. We fight poverty and inequality and injustice. And those three things go hand in hand. And when disaster strikes, we work with our global network of local organizations to address urgent humanitarian needs and protect lives and livelihoods. And in the occupied Palestinian territory, we have worked for decades, since the middle of the 1900s, and then we continue to work there over the years. We've worked in Gaza for decades. Wow. And right now, as I'm sure listeners are aware, we continue to provide life-saving support with more than a dozen partners in Gaza and across the West Bank. And my colleague Bushra will be able to say more because she's calling in from Ramallah today.
Wonderful. Bushra, thank you so much for reaching out across the oceans to share what's happening over there in Ramallah. Thank you again. Good morning.
Good morning, and thank you for having me.
So, on the ground, boots on the ground, what are you seeing over there today? I mean, there is reports that the United States has finally kind of coming around to its senses and partnering with Jordan for some airdrops today. And have you seen any action over there on the ground? Have you seen the things? I mean, I've seen the videos of parachutes bringing down some 38,000 packets of food and everything. Is that something you're seeing on the ground?
Yes, so indeed, airdrops have occurred a couple of times from Jordan, and now the U.S. is following suit. But our position as Oxfam is this is merely a gesture. This is not what this humanitarian response in Gaza needs. A few 100,000 food packages is, a drop in the ocean of need in Gaza right now, where we have 15 confirmed children who have now died by starvation.
Wow.
And this is the fastest levels of starvation that have ever happened in any global conflict. There are famines in other places, but this is a man-made famine where we have rapid levels of descent into starvation and a looming famine over the north of Gaza. People are surviving on one meal a day across the Gaza Strip. We are hearing reports of people going without food for 2-3 days in the north. And this is, directly due to Israeli restrictions on aid that has completely exacerbated the situation in Gaza on top of, relentless bombardments for the last 5 months. So, we've been asking for a ceasefire as Oxfam and 800 other organizations across the world, and also millions of people, in the streets for the last month who have been also calling from a ceasefire, including our Israeli partners that we work with who have been calling for a ceasefire. And now, giving us airdrops of food, that's not the solution. The solution for us to be able to work, for the solution for my colleagues to be able to go and deliver life, saving food and supplies in Gaza is to stop the bombs so that they can drive trucks to deliver food, to go to the warehouse and pick up the food, to, create distribution points in areas where essential supplies can be delivered. We have desalination units. We work a lot in wash and agriculture in Gaza, and the desalination units that we want to install, it's basically impossible because of the relentless bombardment and dangerous situation. So, and airdrops are not the solution. Just like safe zones are not the solution, and temporary pauses are not the solution. Right now, the solution is a political one. It's a ceasefire. It's stopping arms to Israel and U.S. arms to Israel. And then, so that we can do our job, then scale up humanitarian aid, enter the trucks, start a real response in Gaza.
Bushra, thank you so much. This is so heartbreaking, and you are actually there on the ground. And most of the news that I hear coming out of Israel, even with the major news agencies, I'm told that it has to go through the Israeli filters over there before they can publish. You're talking about CNN, BBC, and news agencies like that, John. Ken, you had a question.
Yeah, the ceasefire, that's so important. Now, a couple weeks ago, we did a segment about the International Court of Justice, I guess South Africa, petition to name Israel as committing genocide. And I believe, what is it, John, 13 other countries went on with that. I'm not sure if they came out of it with a determination yet, but let's say they do. Wouldn't that be the perfect excuse for Biden to say, hey, the whole world now is against Israel doing this, and because of that, we're completely cutting off military aid unless you put a ceasefire in right now?
Hey, Ken.
Yes.
Not going to happen.
Well, let's start.
Not going to happen. Let me tell you this. Biden is not running the country at this point. Blinken is running the country. Okay? And we got to hold these people accountable because they're using my tax dollars and your tax dollars to fund this genocide. Let's come back to Dr. Sahloul. Dr. Sahloul, thank you so much for joining us today. So when you went on your medical mission, what was the greatest challenge that you had? How did you guys get into Gaza?
We are part of the WHO EMT initiative, Electronic Medical Team Initiative, which is basically to send medical teams to disaster areas. And the situation of Gaza, of course, this is the worst crisis in our lifetime. So it took some preparation and time to get our first team and a lot of bureaucracy because papers need to be cleared by all parties. And then we went to Egypt, and from Egypt we took the bus to Rafah. It took us about 16 hours in a trip that usually takes 6 hours because there were multiple checkpoints. Okay. And in the road we saw these thousands of trucks that were on the Egyptian side. And these are trucks that are full of food and medicine and clean water. And they were supposed to be inside Gaza, but unfortunately they were in the Egyptian side, some of them waiting for weeks. When we crossed the border, of course, things turn completely south. You see tents everywhere. I haven't seen that number of tents in my life. Every empty spot is occupied by a tent. These are the people who were displaced from northern Gaza to Rafah. Rafah had a population of 300,000 before, now 1.5 million. We witnessed firsthand the complete collapse of the healthcare system, where you have few remaining hospitals bearing the brunt of the injuries, severe injuries from the patients who were brought to the hospitals every day, every few hours. You have mass casualty events. The war is very close to us and to the population. You see the bombs, you see the missiles, you see the drones, you see the fighter jets and the military ships, and then the missiles, and the house is shaking every few hours with the explosion. And in the hospital, you see the impact of that on the mass casualty events, where you see children and civilians brought with extreme injuries due to the shrapnels, and then the medical staff struggling to resuscitate them on the floor of the emergency room, doing what they can with the limited resources. Many of the patients dying or expected to die just because there's no certain surgeons or technology that we have here in Chicago. So it was a terrible situation. And then you have also, of course, the impact of the war on the healthcare system, where 75% of the clinics and the hospitals have closed. So in the clinic that we established in MedGlobal, we were seeing 700 to 800 patients every day. Many of them had respiratory infection. Many of them had, especially children, diarrhea because of the lack of clean water. There was an outbreak of hepatitis. And many patients are suffering and have complications and die because they have chronic diseases and they don't have access to simple medications. Patients with diabetes don't have access to insulin. Patients with seizures don't have seizure medications. Patients with cancer don't have access to chemotherapy. So many people are dying, and they're not counted among the 30,000 people who were killed because of the direct impact of the war. The children that they were killed every day and injured, extreme injuries, even the ones who survived have multiple infections and they have complications. There's 8,000 children, or not children, patients who were awaiting to be evacuated to the neighboring countries. Only 10% of them were evacuated. It's not only the complete collapse of the healthcare system, but the complete collapse of the international system that is supposed to aid these people who are trapped in Gaza, 2.2 million people. Many of them are punished for no clear reason.
Oh boy. Folks, this is coming from people who have just come back from Gaza. This is not somebody who's reporting as a news reporter. These are actual human beings who are out there trying to help. Our money, our tax dollars are being spent in this kind of horrible genocide. John, I don't care what the World Code or the International Court of Justice has to say that genocide is happening or not. Genocide is happening. Yeah. Okay. Let's be clear about it. And if you want to join the conversation, the number to call in is 773-763-9278. Abby, Bushra, and Dr. Sahloul, if you could please hold on for just a second. We'll take a quick commercial break. We'll be right back after this.
Thanks, Mohammed.
Welcome back to the Lightning Strike with Mohammed Faheem.
Okay, folks, welcome back to the Lightning Strike. I'm Mohammed Faheem. With me in the studio today, Ken DeLuc and Alderman John Arena. Also in the studio today with us, Manur Ahmed, who's running for Congress in the Illinois 6th District of Illinois in the upcoming primary. And Dr. Sahloul, I know that you know Manur also. And Manur, you want to join in when you get elected to Congress. How are you going to be addressing these issues that these people are bringing up? The humanitarian, cost of it is horrible. So, what would you bring to the table? How are you going to hold our administration accountable?
Well, thank you, Dr. Sahloul, for all the work that you have done. It's the incredible stories that we hear from him that really give us a good perspective on what is truly going on. We need to really stop the wasteful military-industrial complex. We need to focus on, bringing back money into our districts. We spend $2.8 million alone from our district in funding this genocide. So we need to stop the unilateral military action that undermines the core values of our democracy. We are Americans who believe in the right for humanitarian aid, the right for children and women.
Wonderful, Abby. Again, hats off to you guys for your service. Dr. Sahloul, when you went there, especially Bushra too. Bushra, you said that there is a lot of angst on the ground, not just from the Palestinians, but from the Israelis also. How do you guys mesh with the local Israeli population? What are you seeing on a human-to-human level between the Palestinians and the Israelis over there?
So I'll let also my colleague and Abby speak on this as well. But we don't necessarily operate in Israel. We operate in the occupied Palestinian territory. Right. We don't have programs in Israel, but we work with the human rights organizations that work in Israel, and they are our partners, and we do a lot of advocacy together. And, of course, we are aligned in terms of values that we share. So, I can't really talk about how communities are meshing, but I can certainly talk about the work that we do with Israeli partners on basically, calling for an end to the occupation and an end to the blockade on Gaza, and now for a ceasefire and in Gaza, so that we can, start really working and doing our job in the way that we need to. And I think, Dr. Sahloul, you described and painted such an excellent picture of Gaza and what the reports we're hearing from Gaza here based in Ramallah. I could not have put it any better. But I'll let also Abby speak a little more about how we are seeing the situation in comparison to our broader work at Oxfam.
Thank you so much.
Thanks, Mohammed.
Yes, Abby.
Indeed, we are our Israeli human rights partners, Palestinian partners. There's so much alignment. We work with faith-based, non-faith-based organizations, here in the U.S., as well as supporting our 29 staff who are living and surviving as internally displaced people in Gaza. It's really nothing short of heroic, everything that our team, our partners, and the humanitarian community is able to provide in the backdrop of so much trauma. And I think there's enormous alignment, as Bushra said, for a ceasefire, the safe return of all hostages, access for humanitarian aid, and anything less than that is really a Band-Aid over a massive gaping hole. And I just want to go back, Mohammed, to where you started about the airdrops. And we just want to be clear, we are very supportive of any kind of food, of any kind, of any scale that can get in. It gives a lifeline to people to hold on. But the reason we're concerned about the airdrops is, as Bushra said earlier, it's a real distraction, almost to relieve a guilty conscience of officials where the policies are actually contributing to ongoing atrocities and the risk of famine in Gaza. Airdrops, I want to be clear, airdrops will meet less than 1% of daily needs in Gaza. They are a last resort, and we shouldn't be there. There should be other effective options that enable the humanitarian community, the humanitarian system, who are all positioned, all experienced, all competent, able to scale up in a highly coordinated manner. And so this notion of, where the media coverage talking about something that's going to provide less than 1%, that is actually doesn't even enable coordinated access, can be, we're really concerned that that's a risk, actually detracting from these fundamental things that need to be done, that instead of indiscriminate ad hoc airdrops in Gaza, the U.S. should cut the flow of weapons to Israel that are used in indiscriminate attacks and push for a ceasefire, the release of hostages, and insist that Israel uphold its duty to provide humanitarian aid, access, and other basic services, and the U.S. government needs to do the same.
Wonderful.
Let me chime in here if I can. So a couple of things. First of all, we're really proud of voices like Mahnour's and her representation of totally or completely fresh view of the conflict in the Middle East and humanizing the people in Palestine, because this is what was lacking in the previous policies. And our national interest, and as American and as a physician who's been in other disaster areas, in Ukraine, in Bangladesh, in Yemen, in Syria, in Mexico and Colombia, are undermined right now because of our policies in the Middle East. And the most important thing is to humanize the Palestinians the same way that we do to the Ukrainians, to the Israelis, and everyone else. If we care about the children in Palestine, and I have this habit when I go to crisis areas to ask children, because they don't lie, what would you like to be in the future? And 9 out of 10 Palestinian children I asked, they said, I want to be a doctor. They like to serve their communities. They like to live. They have dreams like our children, except for one child. He was in a shelter in a displacement center. He was 12 years old. He was displaced with his families. The shelter has 40 or 50 people in every classroom. 75 of them will have one bathroom. And you can imagine the situation there. And I asked him, what would you like to be in the future? And he said, what future? I think our country can make the future of the Palestinian children similar to the future of our children, and also the children in Israel and other places, that is focused on rebuilding, on hope, on healthcare, on access to healthcare, access to education, and that's what will change will win the hearts and the minds of the Middle East. Yes, I agree with Abby that airdrops is not the best solution, but every other solution has failed so far. And if anything, Administrator Power mentioned just a few days ago that the number of trucks that entered Gaza were less than before. Only 85 trucks entered in the last couple of weeks compared to 150 at the peak of the entering the trucks through Rafah border crossing. When every measure of getting aid, food and medicine to a starving population and population that is dying because of lack of medicine fails, then that means our country has to take things into its hand. So airdrop is one solution. It's not the perfect solution, but also the administration is also considering maritime corridor, and they're considering other options at this point because every other option has failed because of the reluctance of the Israelis to open the border crossing for the trucks.
Well, hopefully the voices of the people will be heard in Washington, especially the tragic thing that happened last week. Aaron Bushnell, this airman who self-immolated himself for the cause of Palestine, and he said, "I don't want to be a part of this genocide." That was horrible. This is things that are happening in the country, folks. 60 to 70% of the American population is not in favor of us continuing to support this genocide that's happening over there. And it's time that our leaders stand up for humanity and take a stand. That's all we are asking. Hold people accountable. And now with the elections coming up, we, the people, have the power to make a difference. I know that 6 Congress people just came back from Israel, and even they, who have not supported any efforts at a ceasefire or something, they have issued a statement holding Netanyahu responsible for what is happening. And anytime we speak up about Netanyahu or Israel, the first thing that people say is, "Oh, yeah, but what about Hamas? Hamas started that." No, Hamas started that on October 7th, folks. Israel started that 70 years back. So we need to, call it what it is. A spade, and let's not be afraid. This is America. We have the right to speak. It is our right to hold our leaders accountable. Again, we are getting a little bit long in the tooth over here with our segment. Abby and Bushra and Dr. Sahloul, thank you so much for joining us. And we definitely would want to continue this conversation. We also have a 1-hour podcast that we do, and we should probably do the podcast and go into more details. Obviously, on the radio, we can't have too many details that we can go into. We'd love to have you guys come and be a part of our podcast too. And we do 2 kinds of podcasts. One is for the lightning strike. The other is our podcast, The Turning Point. So folks, you can go and visit theturningpointpodcast.com to check out some of the podcasts that we have done. And again, we have a few people that are online. We'll definitely take your questions, but we have to come back with Manur Ahmed for her promised interview on WCPT today. We'll take a quick break, folks, and we'll be right back. Again, Abby and Dr. Sahloul and Bushra, thank you for joining us.